The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Quervain's tendinitis, aka First Dorsal Compartment Tendinitis of the Wrist, by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I am a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. In this video, we will be discussing Quervain's tenosynovitis, or first dorsal compartment tenosynovitis, what it is, how to diagnose it, and how to treat it. We will be giving you some simple home diagnostic tools as well as some simple home treatment remedies that may help you save that initial doctor's office visit. So first of all, what is Quervain's tenosynovitis, or first dorsal compartment tenosynovitis? This is inflammation of the two thumb tendons that run down across the back of the forearm, across the wrist, and into the thumb that lift the thumb up and over. These tendons run under a tight band of tissue right here that's a little bit bigger than a watch band. It's at the level a watch band would be. This is called the extensor retinaculum. These tendons dive under this retinaculum and emerge on the other side. So if there's any swelling or inflammation of the tendons or generally the retinaculum itself, these tendons can be irritated as they're gliding underneath that band of tissue. Sometimes it can cause swelling in this area. Occasionally there will be a cyst, a small cyst associated with it. But more than anything, this is a pain syndrome. There's generally no numbness or tingling, although rarely but occasionally there are some nerves in this area, the superficial branches of the radial nerve, which can be irritated if there's enough swelling or inflammation. And so rarely but occasionally patients will have some numbness over the back of the hand. Numbness in the front of the hand is something else altogether. That's generally carpal tunnel syndrome, which we discuss in another video. So Quervain's is primarily a pain syndrome. It usually comes about slowly. Oftentimes it can be associated, however, with an overuse type syndrome or a repetitive use type syndrome, such as someone who has recently gotten into a new workout routine, or a factory worker who does a repetitive motion, or a machinist who does a repetitive motion all day long. This usually will come about relatively slowly. There's usually no history of trauma or an accident or an injury. And patients will point right here, right to the base of the thumb as the area of most pain. So it's generally relatively easy to pinpoint in terms of where this is sore. This is a little bit more common in folks with diabetes or hypothyroidism or other autoimmune diseases or reason for inflammation in the body. So something that you can do as a simple self-diagnostic tool is really try to drill down to where your pain is. Again, this is typically relatively easily pinpointed. It occurs at the base of the thumb. You feel a little soft spot, that's the edge of the wrist joint, and then you feel a bony bump, that's the edge of the radius, and just above that is where the extensor retinaculum lies. So patients generally will have tenderness all along those tendons, and those tendons tend to wrap up and over the back of the forearm. So you kind of palpate up those tendons, and patients may be sore anywhere along the length of those tendons. Now, the most potent diagnostic tool that you can use and an exam that's almost always positive when I see patients in the office with Quervain's tenosynovitis is something called a Finkelstein test. So wrap your thumb inside your palm, wrap your fingers over it, and then take your wrist into this position. So take your pinky towards the floor. That puts these tendons on stretch and stretches them up against the roof of the extensor retinaculum, and that tends to cause a lot of pain in patients with active Quervain's disease or first dorsal compartment tenosynovitis. We call this first dorsal compartment tenosynovitis because there are 6 dorsal compartments. So under that band of tissue, there are 6 small compartments which all the extensor tendons that lift the fingers run through. The first dorsal compartment holds 2 of the thumb tendons that lift the thumb up and over as discussed. So what are some home treatment remedies that you can do to help alleviate the symptoms of de Quervain's? First of all, really try to avoid any of the aggravating symptoms. So any of the repetitive type motions that cause the symptoms to flare up, try to avoid that. Any workout routines, or if you can, avoid those repetitive motions at work, try to do that. Something else that can be very helpful are non-steroidal anti-inflammatories such as Aleve and Motrin. In fact, this is oftentimes the first line of treatment when patients see me in my orthopedic clinic. There are prescription strength varieties of Aleve and Motrin. Please check with your primary care physician and make sure that you can tolerate those medications.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.